If your lower back hurts way down low and only on one side, I want you to listen closely, because what you're feeling is probably not what you think it is. Most people assume it's the spine, a slipped disc, a pinched nerve, something serious, but very often it's none of those. It's a small joint right at the very base of your back, and it's simply gotten stuck. Today, I'll show you how to tell if that's what's going on, and 4 gentle moves you can do today on your bed to help it settle. Most people have never even heard of it, and it's behind a huge share of one-sided low back pain. One honest thing first, if your pain shoots below the knee or there's numbness or real weakness in the leg, don't do these moves. That's a get-checked sign. And if you already have a back diagnosis, run this by your doctor first. All right, so how do you know if it's this little joint and not your spine? First, the pain sits low, right down at the base near the belt line. It doesn't climb up your back. Second, it's on one side, just the right or just the left. It doesn't cross the middle. Third, it can travel into the buttock or the back of the thigh, but it stops above the knee. It doesn't run down into your foot. Fourth, it flares when you stand up, getting out of a chair, climbing out of the car, going up the stairs. And fifth, this is the one people always nod at. It eases off when you lie down, sitting quietly, lying flat, and it settles down. Sound familiar? If you're nodding along, there's one more little test. Stand up. Put your hands on your buttocks, right over the sore spot, and gently lean back. Arch backward, slowly. If that reproduces your pain right there at the base on one side, that's your answer. Now, do me a favor. Tell me in the comments which side is yours, left or right. I read those, and it helps more people than you'd think. Still with me? Good. Let's look at why this happens. The muscles around your buttocks, the left side and the right, start pulling with different tension. One side gets tighter than the other, and over time, that tighter side turns one half of your pelvis a little forward, rotated, relative to the sacrum, the bone right in the center. That small forward turn is exactly what jams the joint. That's the whole problem. One side rotated forward and stuck. Good news is, we can work on it. That's exactly what these 4 moves aim to do. They rebalance the muscles around the pelvis so those bones can settle back home. Let's do them together, nice and easy. For the first move, you'll need something firm to squeeze between your knees. You'll need a yoga block, a thick hardcover book, or even a plastic food container if it's the right size. A food container can actually work well because it has a suitable shape and firmness. Lie down comfortably on your back, bend your knees at a 90-degree angle, and place the block the long way between your knees. Keep your heels together. Now, give that block a firm, steady squeeze with your knees for 10 seconds. Don't be surprised if you hear a little click or pop in the pelvic area. That's completely normal. It's just the joint releasing pressure. After 10 seconds, take a deep breath and relax. Once you've done that, turn the block to its narrow side. This shifts the focus to a different set of muscles. Give it another 2 to 3 squeezes, holding each one for 10 seconds and relaxing just the same. Now, the second move. And this one is different. You only do it on the painful side. Only the sore side, not both. Stay on your back. Reach down and grab the leg on your sore side with both hands. And draw that knee up, aiming it past your shoulder, not straight to your chest, up toward the shoulder on that same side. The magic is at the very end of the range. Pull it as far as it comfortably goes. Give a gentle little tug at the top. Hold for a second or two, then ease off. Do that 15 times.